The FLC is a gathering of decision makers who can affect change. It is unique in its collaborative nature. It has been years in the making.
I see it as a system of partners that are vested in the community to ensure that we allocate the resources necessary to create a healthier community.
I think the FLC has brought to the table important stakeholders who are ensuring overall wellness, especially mental health wellness, amongst our youth here in our community. And NAMI Paso has been able to bring the voices of our parents and our youth to the table to ensure that they're heard.
We want them telling us how they want to see the services tailored to them, and so that way we can hear it directly for them and we can take that information back, not just within EHN, but our community partners, and say, hey, let's listen to the people that we're serving. Let's listen to our community and come together to meet their needs.
I really like the fact that we're working in unity, that we're working for the same goal. Being able to see that we come together not to maybe compete when it comes to services, but to collaborate as one.
We have not only the FLC as a general committee, but we also have work groups. And these work groups are intended to talk to each other, work on goals that the community needs.
And so there's medical providers, there's nonprofits, there's schools, and we're all seeing a different piece of the pie. And so the FLC allows us all to be in that room and have that conversation.
We alone as an organization working in silo cannot succeed. If we don't succeed, then we fail the families. So working together, collaborating together, having meaningful partnerships is going to ultimately result in the betterment of the families.
Today I invited to a meeting the principal of one of our alternative school that has the children that are there for discipline issues. And I said, so what do you think? And she says, I thought I was in the middle of the ocean all by myself. I did not realize that all of these services and agencies are available.
There are community-wide projects like HOPES that where there was funding made available. We knew that there weren't those type of services being provided in our community, so we got together. We brought in partners and we said, this is the intent of this project. Strong Families is another example, and so those are prevention services that we've been able to offer to our community through the collaboration.
And I think that's vital, especially when it comes to children and families, that whatever the situation, we can prevent it, we can intervene. If you need treatment, you can get it, but we're going to bring you right back to prevent it from happening again.
We now have their residents and fellows train in our clinic, and we were notified that we have served the most children in the entire state of Texas through that statewide program. So that right there is a great example of increased impact at the Child Guidance Center, seeing more kids and families, which prevents them from going into a higher level of care.
I think when you look at things like the sequential intercept mapping and you see what they looked like, literal just images before and after the FLC, you can see so many gaps being fulfilled that were not there previously.
To where we're able to talk candidly about a mental health condition, we're able to talk candidly about a substance use condition, and work together to ensure that people at all levels are able to connect with services, connect with the supports that they need to ensure healthy living.
When we actually talk about the results that we're getting and the impact that we're making, I say the FLC, those that participate and those that are actually sustaining work groups, they've now become ambassadors and promoters of what we're doing.
Our goal for everybody at that table, our goal is the same, and that is to have healthy families in the El Paso community. And that's what we're all there for, and it's really a very united team and a united effort to make that happen.
This network helps to make that a reality and help to extend the services and extend services for families that desperately need it.
So I just think it's really important to consider how complex we are and how unique we are, and to actually use this community to learn from. We've really been trying to invest in pilot projects, I think at the FLC level, pilot projects, things nobody else has thought of, to try to show that El Paso can do this work and that we have the community to support that.
There's always transparency and honesty when we're having conversations amongst the FLC. Sometimes they will be hard conversations, and it'll be tough to get through those conversations, but we know at the end of the day what our mission and what our work here is at the table, which is to provide that support to those families and youth in our community and build the ideal behavioral health system here in El Paso.
And we provide a more proactive and more preventative approach versus an intervention treatment approach.
We stand behind our agencies. We make sure that they are going to be successful, and if they're having barriers, they can come to the FLC and discuss those barriers with us. And we will rally behind any organization that has received money for this community.
We just all fit together as if we're just looking out for the best interest of El Paso.
And when we collectively pool those resources, those minds, those ways of thinking, those strategies, those insights, then guess what? Nothing will be impossible for those group of leaders, those group of organizations that really want to make a change in their city.